I'd like to welcome Laurel MacInnis, Orthopedic Surgery Physician Assistant. Welcome, Laurel.
Thank you, Nicola and Anna, for having me and inviting me to this event today. And I'm happy to speak to you about my profession and how I arrived at becoming a Canadian certified physician assistant. So I thought I'd start with just a little bit of background on how I came to the profession, my education, and then I have a short PowerPoint that outlines what a physician assistant, or PA, as we like to call ourselves, what we actually do, what our role is, and then if you want to ask questions about that or how you can look into the program, I'm happy to answer those questions. So to get started, I am from Halifax. I went to JL Ilsley High School. And during that time, I knew that I was very interested in the human body. I love sports and biology. So I geared all of my courses towards potentially moving into a science degree. I applied to Mount Allison, and I was accepted to Mount Allison in biology degree. And during that first year, I actually decided to transition into human kinetics. So I transferred to St. FX for human kinetics, and I was lucky enough to pursue that degree, finish that degree. And I worked in a physio clinic for 2.5 years. And during that time, I also worked as an athletic trainer with several sport teams. So a few high school hockey teams, national football team. And then I went over to Austria to do a little bit of travel and worked with a professional team over there. During that time, I knew that I wanted to pursue something more, likely in medicine. I didn't know about the PA profession at the time. But I was lucky enough to run into one of our orthopedic surgeons in Halifax through the physio clinic I was working with. And he introduced me to the PA role. And at that time, this was over 10 years ago, he was looking at how he could help to advocate for PAs and bringing them into the maritime provinces. So after he told me about the profession, which I'm excited to tell you about today, I applied to one of the programs within Canada and went out to Toronto, and that's where I pursued my professional degree as a physician assistant. I've been working as a physician assistant now for approximately 7 years. I worked 3.5 years in Toronto in an emergency department. So sorry, it's been almost 6 years. And then over 2 years now in Halifax in orthopedic surgery. So physician assistant role in Nova Scotia. And I want to talk to you particularly about the PA role coming to Nova Scotia. We're currently in a pilot project, meaning the role and the career is not permanent yet in Nova Scotia, but the great news is it's passed legislature through its first reading, meaning we are looking at bringing our career and the role here permanently. So if you are looking into the role and pursuing this degree eventually, we will be looking for more PAs in several different areas of medicine, and this is very exciting to us. Great. So what is a physician assistant or a PA? PAs are highly skilled healthcare professionals educated in a medical model who practice medicine. So the two types of degrees, you can either gain a bachelorette or a master's degree affiliated with one of 3 medical schools in Canada. And we practice medicine as a direct extension of our physician or surgeon. We can work in hospital settings, clinic settings, and we help to extend physician services. So we can move on from there. I'm trying not to read directly off of the...
It's great, thank you.
So the PA training. We are trained in the same medical model as the physicians we work for, meaning if you're looking at a mid-level professional, such as a PA or a nurse practitioner, often NPs or nurse practitioners will have a nursing background. We begin with basically a science degree, and then we move into a professional degree such as, we move into basically something where there's a clinical setting, like a physiotherapy clinic. So we have a lot of people come from paramedicine, and then you move into the PA profession. So we really like to have some type of hands-on clinical experience before you become a PA. And the three programs that are offered in Canada are through University of Toronto, McMaster, and University of Manitoba. All three of these universities have accreditation, and the PA program is run through each of their faculty of medicine. The prerequisites, so they're a bit different for each of the three universities. The one I can speak to mainly is University of Toronto. So again, they prefer to have an undergraduate degree, 2 years of hands-on clinical experience, and then we look at GPA, mini MMIs, and the PowerPoint refers to something called a mini multiple interview, similar to medical school. If you're looking at an MD, you still go through the same interview process. And the program itself is 2 years, but it's 24 months consecutive didactic and clinical training. So didactic training means in your first year, you're sitting down, going through lectures. We have a lot of the MD pre-recorded lectures, and then all the similar textbooks that the medical students would be reading. We're going through the same kind of curriculum. And then in your second year, you have 12 months of medical rotations. So when you think of a resident, I don't know if you've watched any of the medical TV shows, but if you think of a resident who goes through each of their rotations in family medicine or internal medicine or general surgery, we have to go through all of those rotations as well, and they're a lot of fun. Once you get through all of the basic training, you really want to get your hands on. So the second portion of the training, you're in those rotations along with full-time course load. So it's a lot, but at the end of your program, it's a great profession. And we do write a national board exam. So this allows us to be certified through the College of Physicians and Surgeons of Canada. And similar to a physician, we have to continue our mandatory continuing education CPD credits, which means as a professional, every year I have to do a certain number of readings or conferences, teaching to keep up to date with medical literature, just like my supervising surgeon. Where do PAs work in Canada? So currently, the PA profession is growing significantly within Canada. It's been established in the United States for a very long time. PAs are relatively new to Canada within the past few decades, and the profession started in our military and now has moved into civilian practice. So military PAs work across all provinces, territories in Canada, whereas currently civilian PAs in hospitals and clinic settings are mainly in Alberta, Manitoba, Ontario, New Brunswick, and Nova Scotia. We know that currently PEI, Newfoundland, and BC are all looking at expanding and bringing PAs into their provinces as well. So scope of practice, scope of practice means what are we allowed to do as a healthcare provider? So physician assistants practice medicine within the scope of practice of our surgeon or our physician's scope of practice. This means if I work with an emergency physician, I will be practicing their scope of practice, the procedures, the interventions that they practice. If I work with an orthopedic surgeon, I will be practicing under his or her scope, which are different. I don't know if that's obvious, but they are doing very different things. There might be some overlap, but as the PA, as an extender of that professional, I can only practice under their scope. Although I can switch, just like I have in my own career, from one specialty to another, it's interesting. PAs, some things we do, assist in surgery. So I'd be a first assist currently here in Halifax with a number of different types of surgery. We prescribe medications, we perform procedures that fall within our scope and training. And our practice mirrors that of our surgeon or physician again. And eventually, generally within the first year of our practice on a specialty service, say I was working in general surgery. I graduate from University of Toronto or McMaster. I'm in my first year of practice in general surgery. That first year is a chance for the surgeon to train me in their protocols and their preferences. After that, you start working a little bit more autonomously. So as you gain a trust and a relationship with your supervisor, you start practicing a little bit more autonomously. So I'm not going to read all of these out loud, but these are just areas in medicine that PAs work. We do tend to focus on family medicine, emergency medicine, and a lot of the different surgical services because this is where the need is, and primary care, as you know, in Canada and Nova Scotia, to have an extender help you with your patient load is a big help. And so, yeah, I'd say you can read through that list if you're interested. We can continue. So again, these are just some of the things that PAs can do. We can order laboratory and diagnostic imaging, interpret results, and then when we interpret those results, for example, and if I ordered an X-ray for someone in the emergency department, I would either make a diagnosis or I would create a differential diagnosis, which is just a collection of what the most likely diagnosis would be. And then we can treat patients in hospital, as outpatients, in clinic, and in the operating room. We assess our patients in pre-op settings and post-op settings. So this means if you came for surgery or if you needed surgery, I might see you before surgery in a clinic with my supervising surgeon, and then you'd have surgery, and then we would reassess you, how you're doing, how you're healing in the clinic afterwards. So PAs can do that. We share the load of the patient load with our supervising surgeon, and we consult and refer patients to specialties. So this could mean, for example, in my job, if I'm on the floor seeing patients who are admitted to hospital and I think someone's sick and I've ordered some laboratory tests, I might have to consult general surgery outside of my scope and ask for their help to come see the patient. And we also prescribe a set list of medications. I just included a few infographics about what we do, but this is just covering the same information. And these infographics are by a PA in Ontario named Anne Dang. If you're looking for more resources on the profession, she's got a great website linked there, and I've linked it at the end as well.
That's great. Thank you, Laurel.
Yeah. Things that we cannot do. So PAs cannot prescribe narcotic medications such as opioids. We cannot practice without patient consent, but that's pretty much all healthcare providers. And then we cannot complete any procedure order which is outside of our scope of practice of our supervising physician or surgeon. And why introduce PAs to Nova Scotia or provinces or the Maritimes? So this is really just covering basically the way that we help with efficiency in the medical setting. We help reduce wait times. So for example, in Toronto, when I worked in the emergency department, instead of a patient waiting 6 hours to be seen for a laceration, a cut, that I would see them within an hour. If my supervising physician was too busy with an acute patient in the trauma bay, I could see that patient, take care of them, suture them, set them up for care afterwards. And it really helps improve patient care and access to care. We help reduce physician burnouts. There have been some papers that look at the reduction in paperwork and time spent with patients. So you can imagine if I see on average 1/3 of our clinic, that helps free up some of the surgeon time for them to work on paperwork or something else. And overall, I won't go through all of this list, but we do help to extend our physicians and provide access to care. And this is another infographic, which we won't go through, but it's here if you would like. Again, this is by Ann Dang, which is on her website her blog, sorry. So specifically, this is just talking about my role on orthopedics, on the orthopedic surgery service. However, there are so many different services and areas of medicine that you can work. And as a PA, you're open to working in all of those. Again, I work in a fracture clinic and something called our orthopedic assessment clinic. So there are a lot of people within Nova Scotia who need hip replacements or knee replacements, and I help to see those patients in clinic. I also work with a trauma surgeon, and so I work in fracture clinic, which is seeing referrals from the emergency department or patients that we've operated on in an acute setting. And then we work in the operating room, and PACU is post-op care unit or post-anesthesia care unit. So that's working directly in the OR, assisting, opening, closing patients. We help anything the surgeon really needs hands-on, we help with. And then consulting. So that just means, again, I've covered that. If I needed to talk to someone outside of orthopedic surgery, I would consult a different service. Inpatient units, so we round on our patients in the morning, which just means we're checking on them, how they're doing the next morning after surgery, or if they're staying with us for a few weeks, we make sure that they're healing well and everything's going well with their care. Yeah, and basically our job in the pilot project right now is to integrate the PA profession into our orthopedic program, and we're hoping to expand again into other services in Nova Scotia. Those are just these are some of my interests. So it's just showing that although you can work in medicine, there's lots of other things to do. And I should say on the previous slide, I forgot to mention, we work directly with fellows, residents, nursing staff, allied health. So that's been a great experience as well. As a new provider to Nova Scotia, everyone is very welcoming, and we work well with the nurse practitioners, our surgeons, and so forth. And then
Oh, that's
That's
still
the
on that one.
story.
Yeah, that's okay. Thanks, Laurel.
And interested in knowing more. So again, if you want, I don't know if you want to write this down, or we can always provide you with this, but the Canadian PA blog by orthopedic surgery PA Ann Dang, she's got a wonderful blog out there, which goes through everything from what each program in Canada consists of. So what, for instance, University of Toronto has a lot of online education, and I know with the pandemic, things have transitioned more towards that. Whereas McMaster did a lot of problem-based learning. So just like their MD degree, McMaster is geared more towards problem-based learning. But her blog really outlines a lot of that. And then again, how to apply, how to make your application look great for the PA programs in Canada. And then Conference Board of Canada, the value and efficacy of PAs in Canada. These are 2 documents that were written based on data collected in Canada on PAs. And if you're interested in knowing more about PAs, those are great references. Finally, CAPA, that is our governing body. So the Canadian Association of Physician Assistants is our governing body across all provinces and territories. And they, again, they've got a great website, and yeah, that's it. So thank you for having me. And if you have any questions that I haven't covered, or if you want to discuss anything, please let me know.
That's super. Thank you, Laurel. How exciting. Because I think you are so relevant to Anna, I'm going to let Anna lead off the questions.
Sure.
Yeah, thank you. That's so awesome. I actually wrote down this PA blog and those things to look into because I think it's really cool. You told us a lot about like why you chose the career and stuff and the education that you had and training experience. So I just want to ask, like, what do you love most about this job?
I was always a kinesthetic, hands-on learner. And that's why I did transition from biology, which is a great degree, but I learned more about human kinetics. And from there, the thing I love about my job is I get to be hands-on, and based on the curriculum and medicine, I really enjoy the hands-on component in working with patients, and every patient is a little bit different. So you meet a lot of people, but I just find medicine in general, the human body, very interesting. And as a PA, the exciting part is we do have the hands-on. There are obviously restrictions into how much, for instance, in the OR, we won't be doing anything of the super technical parts of the surgery, but we do still help with the surgery. We get to be completely part of that and immersed in that, and knowing so that would be my main. I love waking up every day and going to help patients, and also being part of the hands-on, with a team.
That's awesome.
Yeah,
that's awesome. It seems like every part of the team is super important, and
every part of the team. Yeah, and again, that's another good point. Working directly with all of the other healthcare providers, we're a team, so you get to learn about other people's professions at the same time. You have that social aspect at work, and there's always the other great part about being a PA, and it was something that drew me to this profession, is constant continuing education. So similar to a physician or surgeon, we are required to constantly learn about new technologies in medicine, new practice, new protocol. So it's fun because you never plateau. You're always learning something.
Thank you so much, Laurel. We are out of time, but I'm going to give just a minute, less than a minute, if there's one question that pops up in the chat. But in the meantime, I do want to say thank you so much. This is so special to have you here because it is so new and groundbreaking in Nova Scotia. It's very exciting, I think, for the healthcare profession. And again, I know you're in clinic today and you've taken time to be with us, so thank you so much. Anna, is there anything in the chat yet?
Nothing has come up in the chat yet.
Okay, if I get questions from teachers, Laurel, if you would consider taking a moment to answer those and get them back, that would be great.
Yep, absolutely. Thank you so much for having me.
Thank you, that was wonderful.
Thank you.